Hey guys, alright, so I know I haven't posted in a while, but there hasn't been really much to post except for now. I did some tests, so if you don't know, what I had to do was I had to do a series of tests to see if I can get on the transplant list. With transplant, I'm going to call it in phases. I don't think they call it in phases, they kind of just tell you what to do, but I'm just going to put it in phases. It's probably how it is called, is phases. But phase one is I get registered, I get put in the system, then I do some blood work, I do some urine, so they check my A1C and they check my weight. And so when all those come back okay, then I can proceed. Well, they meet with the doctors. So the nurse meets with a group of doctors, the transplant doctors. They look at my case and they say, okay, well, we think it's okay for him to proceed on to the next stage, phase two. So they said phase one, they said that my A1C was a tad high, but it was okay. They actually wanted it was at 8.0. But they said as long as it was below 11, or maybe it was 12, as long as it was below that, I was okay. And then they said my BMI, my body mass index, my weight, was just on the line. I needed to be, I can't remember what it was, but I needed to be at a certain number, and I was 1 point higher than that. And they think that I was 1 point higher than that because I have fluid in my legs. I have a little bit of edema in my legs, which means I have a little bit of edema everywhere, but like, I mean, it builds up at the lowest point, so it's in my legs. And they said that's probably what's adding to the weight, so you're probably actually in range. And the doctors reviewed that, said, well, he's not on dialysis, so he's probably is packing on extra fluid. It's okay for him to proceed to phase two. So phase two is where we did the CT, it's where we did the echocardiogram, it's where we did the stress test, it's where we did the radioactive stress test, it's where we did the x-ray, it's where we did the blood work, and so where we did all that stuff. And then once I pass that, I think phase three will be me. Oh, I also needed on phase two, I needed dental clearance saying that I have no infections or anything like that or cavities, and then my pneumonia vaccine. Once I get those in, I move on to phase three if the doctors all approve, because then they present all this information in front of the doctors and they say, okay, he needs to get this fixed before we can move on to phase three, or he needs to do this treatment before he can move on to phase three, or he is not currently eligible to move on to phase three at this time. So right now, with all of my tests, what they've said is that I need to see 2 more doctors, and then if those come back okay and I talk to them and they say I'm fine, then I can move on to phase three, which means I think phase three is where I get put on the list and then I wait for a transplant. And then I think I have to continue to keep these things updated too until then. So I need to maintain that kind of level of health. What we did is we did a number of those tests. We did a echocardiogram, where they took an ultrasound of my heart. They do that for about, I don't know, it felt like 30, 40 minutes. They had this long list of views that they needed to go through. And so, we went through each of those, checking the flow of my heart, checking, the shape, the size of each ventricle and atrium and the vessels. And so we did all of that. And then I had to do a gamma stress test where they ran gamma radioactive stuff through my veins, and then they put me in something that almost looked like a CT scanner. It's kind of round. The scanner comes to your chest, and then you sit there for 5 minutes as they take a series of pictures, like I guess continuous pictures, as you sit there. So I had to do that once, and then I went and did a EKG stress test. They put a bunch of leads on me, and I walked on a treadmill. They had to give me this drug, and to be honest, I can't remember what it was, but it wasn't fun. Because I'm on beta blockers, they had to give me something to help actually increase my heart rate. So they gave me this drug as soon as because they put an IV in me, and then they gave me this drug as soon as I started walking on the treadmill. And then like almost instantly I got out of breath and I felt dizzy and lightheaded, and I wasn't walking very fast, but man, it felt like I was pushing through like mud walking on this treadmill. And so they were really stressing me out, I guess. So after the stress test, I then had to do another one of those scans, but they did one on my chest for 5 minutes, and then they did one on my back for I think it was 3 minutes. So I was laying supine, my back and my chest facing up, and then they put me on the scanner. And then I was prone, where they put my chest on the ground, and then the scanner on my back, and I was kind of pinned there for the first one where I was supine was 5 minutes, and the one where I was prone was 3 minutes. And then after that, I was good to go. So then I went on to do a CT scan. They did a CT of my abdomen, and then they did an chest X-ray, and then we did blood work, and they took about 35 vials, maybe it was 30 vials of blood, and then we went over to the UK office for transplant, and we spoke to their social worker. The social worker then gave us some information saying that, hey, if everything comes back right and we proceed to the transplant, this is kind of what it's going to look like. You're going to be on this list of drugs, and it was a huge list of drugs. It was there was probably about 10 or 20 drugs on there. There was 3 for immunosuppression, and then there was a list of that are for the rest of my life. I'll be on these immunosuppressants, but then all the other ones will either be as needed or for 6 months at the beginning stages of the surgery. So they kind of put you on these lists of drugs just to make sure that everything's okay. They'll press your immune system, give you some antibiotics. They'll give you some stuff to help with pain. They'll give you some stuff to help with different levels and all that. So there's a ton of medications, and from what I understand, it's for the first couple weeks it's going to be pretty rough. I think they suggest a minimum of, I think you're out 12 weeks before you can proceed to go to work. So hopefully I can get that all squared away, because I'm not going to be able to work for 12 weeks after the surgery. So yeah, that might be problematic, because I mean imagined I was going to be out for a little bit, but I don't know, 12 weeks is, I mean, uh, you know. But and it could be longer depending on how my recovery is too. So for those initial 12 weeks or more, I won't be able to work. And so I need to try to find some other source of income, or see if I can apply for anything and see. And I have no idea what that looks like. I got to talk to the social worker about that and see what other things I can look into about, maybe getting some assistance during that time while I'm off work. And we kind of talked about, what the rest of my life would look like if I was on immunosuppressants and this transplant, what my job entail. And it doesn't seem like I could do healthcare, because I will always be some kind of immune suppressed. It just depends on how my body is with it. So they'll have to give more, or give less, and this is gonna kind of be a thing for the rest of my life. So I work in healthcare, so I think I would need to try to figure something out, either away from patients or outside of healthcare, to determine, do a different job. So I found out yesterday what my test results were. So my EKG was abnormal, which means she didn't say, if it was one way or the other. She just says you're going to need to see a cardiologist. And if the cardiologist approves me, then I could proceed. But I also need to get my pneumonia shot, my pneumonia vaccination, which I just did. That was $200, if you believe it or not. But hopefully my insurance will cover it. I'm not sure yet. but it was $200 for the pneumonia vaccine. So I got the pneumonia vaccine, and I just went down to the little clinic and got that taken care of. It was like 2 minutes, not a big deal. But I need to get my dental work because they want to make sure you have no cavities or no infections in your teeth or in your gums that could potentially harm, because once you're on immunosuppressants, you know, that could be 10 times worse. So they want to make sure you're clear with there. And then I got to see the cardiologist because they said some things popped up on my EKG on my stress test that they were concerned about. They also, on my abdomen, they found some slightly enlarged lymph nodes in my abdomen. But they don't know what that means. They said it could be a number of things. They want to do another scan in 6 months. And if they're growing, then that could be a problem. Don't know what kind of problem that is. I mean, we could talk about infection or cancer or who knows. And then they said that the lining of my bladder was thicker, but that's probably because I'm not producing as much urine because of my kidneys failing. So I guess with stress and all that, it gets a little bit thicker. She said that's normal. She also said something else popped up on the test, and I need to go see a doctor about it. I don't want to mention it at this time because it might not be a problem at all, and I don't think there's no need to talk about it and get people worried about it, or, you know, if it becomes a problem, then I will. They don't think it is a problem. They don't think that there's any, because I'm not showing any symptoms, and I know I'm being terribly vague, and I don't want to be, but for particular reasons, I need to be kind of vague. So we have to go talk to this specific doctor, and then the doctor can approve me, or he could put me on a treatment or some kind. So we'll see. But you know, I'm sure everyone's mind will go a million different directions on what this could or could not be. But I'm just gonna say this: don't worry about it right now. They told me not to worry about it right now. They said talk to the doctor and he'll make his decisions, but you're not showing any symptoms, there's no issues, so you should be fine. So we'll see. And then not all the blood work has come back just yet. So I still got a bunch of blood work that has to come back, which we'll determine. So that's kind of where we're at. So I got some blood work to do, and that's not all done yet. So once all the blood work's done, then we'll know where we're at. But right now, as of right now, this is where we're at right now. This is what we know. So again, thank you guys for all your prayers and support. I really appreciate it. It means a lot to us. We're still learning and growing and trying to move to the next step. Symptoms wise, I sometimes get dizzy, sometimes I get lightheaded, sometimes I feel sick. I feel like my symptoms are progressively getting worse, but not so much that it's debilitating. Like, I think I'm melting on the inside, but on the outside, I think I still look handsome. I think I still looking sharp. It's just on the inside, it's not all working out. So please keep my family in your prayers and support, and we really do appreciate it. So yeah, once I find out more information, I'll let you guys know. But at this time, it's kind of a waiting game. Once I get those other doctor's appointments taken care of, and once I find out more about my labs, then we can kind of move on, and I can let you know. If you know anybody who is wanting to become a living donor, or you yourself want to become a living donor, please contact this phone number here, and they can provide information to you to be my living donor. So she'll send you some paperwork, and then they'll go through the screening process, and hopefully we can be a match. But yeah, that's where we are right now. So I mean, I'm a little nervous. I'm a little nervous about the whole thing, because I've heard stories and they don't seem great. So yeah, anyway, Thank you guys. God bless y'all. Have a great day. Peace.